This is Chapter 24, The Child with Hematologic or Immunologic Dysfunction, and this is Part 4. This will be a very short lecture, though. So epistaxis, this is nosebleeds. Kids get nosebleeds, right? It just happens. They fall and they bang their nose. Usually it's just a vessel towards the tip of the nose there on the inside gets, ruptured, torn, broken, and it bleeds. So the best way to get rid of this is to pinch their nose up to 10 minutes. We do want to stay calm and keep the child calm. A child who's screaming is going to keep their blood pressure up, is going to keep that blood flowing to that vessel that's bleeding. So getting them to calm down, to sit quietly, pinch their nose, and lean their head forward. Kids seem to kind of automatically lean their head back, which makes the blood just run down their throat. So leaning forward and pinching the nose is what we want to do. If it's really bleeding badly, you can put some ice on the bridge of the nose to kind of decrease blood flow there. But pinching for up to 10 minutes, that's a long time, but they say just about every nosebleed will stop if you pinch it for that long. Occasionally there's a terrible bleed that just won't stop and you have to go into the doctor and have them pack it. The problem with packing it, you can make that bleeding stop. You put pressure in there so it's pushing against the vessel that's bleeding until it gives it enough time to form a clot, and then you pull the packing out, pull the clot off with it, and now it's bleeding again. So that's the issue with packing. But sometimes it is necessary. In the absolute worst cases, if there's one vessel that just keeps bleeding, occasionally they'll actually go in and cauterize that one vessel so that it can't bleed anymore. But most of the time, just pinching and leaning the head forward. So kids occasionally fall and bang their nose, but a lot of the time it happens because they pick their nose. So teaching them not to pick. The other time it happens a lot is during the night. Their nose gets dry, it gets itchy, they kind of pick it, and they get bleeding, and they wake up in the morning and there's blood on their pillow. So to prevent that, we want to keep the inside of the nose nice and moist. So put a little bit of Vaseline inside the nares, each nares, at bedtime, and run a cool mist humidifier so the nose stays moister. It doesn't get dry, it doesn't get itchy, they're not picking in their sleep. So that should help as well. Immunologic deficiency disorders. This is AIDS, which is caused by the HIV virus. Now, just like adults, we're going to treat these kids with antiretroviral drugs because this is a retrovirus. When the immune system is not working, there's opportunistic germs multiply. So we're going to try and prevent those secondary opportunistic infections, and we're going to educate them about the spread of the disease because this is a carried in blood and body fluids. So they need to know, that they're not doing things that are sharing body fluids, or if they're bleeding, that it immediately gets covered and cleaned with a bleach solution. So most kids who have AIDS, they get it during birth. Very, very rarely does it cross from the mother to the fetus prior to birth. It's usually a blood exposure at birth, or even more often it's from breastfeeding because it is present in breast milk. So a mother who has HIV, we need to tell her not to breastfeed, and we need to be very careful during birth so that we don't introduce the virus to that infant. However, it really is a minority of HIV positive moms. A minority of their children will end up positive. So as long as we can prevent that exposure, they usually do just fine. Stay negative. So moving on to blood transfusions. So how are we going to give a blood transfusion? We've talked about a lot of disorders that we may need to treat with that, so we have to verify the recipient and the donor's blood type, so that ABO and the RH, and this takes 2 nurses looking at it to verify it. Most reactions occur early on, so when you start a blood transfusion, you do vitals before you start them to get a baseline, including temperature, and then at 15 minutes, and know what your hospital policy is, but most of the time you're going to start it at a slow rate. After 15 minutes, do the vitals. If they're still normal, then you go up to the rate you're going to go to. And then again, know what your hospital policy is for during the transfusion, and then you're going to do them again after you complete it. Blood does need a special blood filter. Our normal IV filters are too small, so you can't fit blood through them, but we don't want to let little clots through, so we're going to use a filter. We're only going to use normal saline to flush, nothing with dextrose in it. When you pick up blood from the blood bank, it has to be started within 30 minutes of arrival. If something happens and you're not going to be starting it, that blood goes back to the blood bank and you go pick it up later when you're actually going to start it. So if the IV came out or something happens, you don't just leave it sitting there. You take it back to the blood bank. Once you spike that bag and start the infusion, you have to finish it within 4 hours. It can't take longer than that. We're going to be watching for reactions. If a reaction does occur, we do not want to give that person any more blood than they've already been exposed to, so stop it immediately. We are likely to need to give them something else IV, so disconnect and flush that IV line so that we have a working saline lock, or if they have something infusing, that's fine. You can hook some normal saline up to it, but we want to make sure we have a good working IV and we're giving them no more of the blood, and then we call the physician and notify them of what happened. So here's a page that shows some of the different reactions. Our very worst are hemolytic reactions. These are the most severe. Fortunately, they're very rare. They happen quickly though and are life-threatening. Febrile reactions are quite probably one of the more common reactions. Fortunately, none of these are common, but so we have to take temperature with those vital signs, right? We're watching for fever and chills. You can have an allergic reaction. It can be to something in the donor's blood or some of the preservatives they use when they process the blood. We've got to watch for circulatory overload. If we have a heart that may not be able to handle the volume, and a lot of times we're anymore splitting blood into its components so that we can give just what we need without a ton of volume. Air. Be careful, especially if this is being given under pressure because of, some sort of a trauma, and they're losing a lot of blood. We're trying to give them blood fast. When you're under pressure, you can give air, and if you are giving a lot of blood and giving it fast and it's not at body temperature, you can give them hypothermia. You can throw their electrolytes off, particularly calcium, hyperkalemia, and then citrate intoxication, which is the calcium will change your calcium, and that's from preservatives that they add. So apheresis is when we take blood from our donor, we take off what we need and we give the donor the blood back. So we're only taking a portion of the blood, not the whole blood. And this is often done for platelets, to collect platelets when we don't need the whole blood, we just need the platelets. So that's what apheresis is. It's taking the blood from the donor and just taking a certain component of the blood out and giving them the blood back. And by doing this, by being able to give a lot of platelets rather than whole blood, that's been a great thing for our cancer treatments.